Welcome to Pro Webcast News, where we bring you daily industry updates. Today is Tuesday, April 13th, and you're watching the Afternoon Update with Paul Wilson. Today's news is sponsored by Covenant Reliance Producers. We build success stories. For more information, please visit crproducers.com. Now for today's headlines. Americans' biggest fear regarding having a long-term care illness is becoming a burden to their family, according to a survey released today by AgeWave and Harris Interactive. The survey found that 55% cited becoming a burden on their family as their greatest worry in the event they could no longer take care of themselves. Meanwhile, death was of the least concern, with only 10% of respondents listing this as a worry. Other fears listed included ending up in a nursing home at 24% and depleting savings at 12%. Yet despite these concerns, the survey also found that few Americans have even discussed with their families the type of long-term care they would like to receive if it were needed. Specifically, 92% of spouses or partners had not discussed important long-term topics with each other, such as identifying preferred options or costs of care, defining roles and responsibilities of family members who might oversee care, and discussing possible sources of funding for care. Meanwhile, 95% of parents had not discussed these topics with their adult children, and 96% have not had these talks with their parents. In healthcare news, a recent global survey from Accenture finds that most people believe government should help facilitate access to healthcare and ensure resolutions of problems with health services. The 16-country healthcare report found that facilitating fair and easy access to healthcare services and ensuring prompt, effective resolutions to problems or difficulties that patients and the public experience with health services topped the list of actions that respondents most desired from their governments. In addition, the survey found that failing to ensure that citizens are engaged in the decision-making process related to health services is an area where government performance is often perceived to be lacking. According to Greg Parston, director of Accenture's Institute for Health and Public Service Value, quote, "It's interesting and encouraging that despite cultural, socioeconomic, and other differences among the 16 countries, there is a great deal of consensus around the need for government to help provide fair and equal access to health care. But governments must do more in enabling people to play a role in helping shape the policies and programs to achieve that access. We have seen consistently in our research that citizens want to be co-producers of public value," unquote. In regulatory news, former Washington Mutual Chief Executive Kerry Killinger today said that Regulators unfairly seized the thrift in September 2008 before selling it to J.P. Morgan Chase & Company for $1.9 billion. Speaking before the Senate Permanent Subcommittee on Investigations, Killinger said that although the company suffered due to rising loan losses, it was managing to make its way through the crisis. The subcommittee is holding the first of 4 hearings on the causes and results of the recent financial crisis. In today's hearing, Killinger and other former Washington Mutual executives will testify about the role of high-risk loans in the thrift's demise. I'm Paul Wilson, and thanks for watching Pro Webcast News. For more in-depth news and features, visit producersweb.com.